What are the benefits to suppliers for this technology in Florida Hospital, and are the RFID costs shared or supported in total by Florida Hospital?
I don't know the supplier costs. I can't tell you exactly. I know there's an initial setup cost to the supplier, but the benefit that I see for the supplier would be that they would be able, because the supplier does have to have a bag of goodies that is sufficient to please many hospitals. Yes, you have to have many sizes, but they might have 500 SKUs, and out of those 500 SKUs, they end up throwing 250 of them away every quarter when they expire, or on a monthly basis as they go, because they're not efficient and they're not being tracked properly. Wavemark would give them the ability to maximize on those products that are mostly needed, reduce their levels of ship to items. They would be able to ship more efficiently. I mean, maybe even reduce their shipping to once or twice a month based on usage, so they'd save on that. They'd also be able to maximize on those high turnover products so they can bring in more revenues. Because it's okay to, for an example, when I first started working here, I'd have some of the manufacturers that would give me everything they had in their bag, thinking that because they have all this visual space, they're actually going to get more higher turnovers. Now, some of those manufacturers that are on the Wavemark program will give me one shelf of only what I need, and they'll actually have higher turnover rates and higher usage than everybody else because they have the information to recognize what hospitals really need. So I would say they would benefit more than we would. For us, it's just necessary to be able to have on hand what we need every day. For them, it would maximize on their rate of return.
We had a couple of questions having to do with the RFID tags. And one of the things I wanted to say is that this is a passive RFID technology. And the cost per tag is about 30 cents per tag. Let's see. Do you automatically reorder a no-cross stent, or can you hold an order in Wavemark in case the vendor replaces it?
Here at Florida Hospital, most of my vendors replace no crosses for us. What I do is there's actually a basic disposition report. At the point of service station, it's a touch screen. When the product is registered to the encounter, to the patient, if it doesn't cross, the monitoring tech can actually touch the screen and change the disposition from used to no cross, wasted, or failed, or defective. There's 4 or 5 categories that they can change the disposition. And since they do this, I run a monthly report on everything that didn't cross. And I'll actually fill out all the no-cross documentation for the manufacturers, making it easy for them to supply me with what I need, not having to have all the information that is, I'll actually have the serial number, the date it happened, the encounter, the patient information. We don't share the patient information, but it'll be all available at my fingertips on one report. So my inventory clerks don't have to worry about saving every wire and every box and filling out documents.
You mentioned that you put 2 RFID tags on the boxes. Why do you do that?
The shelves actually have readers on the bottom of every shelf, I believe it is. The way that we place the boxes on the shelf, if by any misfire the bottom tag doesn't read, the top one will read based off the shelf above it. It's just a fail-safe so everything is read properly. It's recommended. Some boxes we only put 1 tag depending on where like on the tall boxes we'll only put 1 on the bottom. But most of the time we'll put 2 just to guarantee each product is read.
If the supply is registered to an account or a patient and it is opened but not used, does it get charged to the patient?
No. If it's opened, there's 2 different things. Let's say we waive it and we charge it to the patient. And then we don't use it. If it's not open, we just put it on the shelf and it'll disappear from the encounter and it'll automatically show up in my inventory again. It's auto-correcting. But if it's opened and it's not used, you change the disposition on the XPOS screen. Like I said, you touch the touch screens in the room, and you change it from used to wasted. It automatically goes in our wasted report, which we eliminate from the patient file.
Have you ever had problems with transactions due to read errors?
Some of the read errors, if we do have them, are usually our own. We're registering so many products that come in, and we'll have one that we didn't register correctly, and we put it on the shelf. And when the tech takes it off the shelf, it says it's an unknown product. The antennas, which are the actual tags, are not recognized because they're not registered properly, and we fix those one by one. We actually have a report in Wavemark that shows us any unknown products that we put on the shelf. It shows us our own errors on a daily basis, so we'll go around finding them so these things don't happen frequently.
I'm kind of coming to the end here.
That's okay.
Have you been through a Joint Commission audit with the system, and what has been their reaction?
Joint Commission comes by every once in a while. I haven't been physically in one, but we have our Joint Commission, our JCO that comes by. And the only thing that we have is we actually store a few things on the top of the cabinet. It reads about 6 inches over the shelf, and we try not to stock anything too high on it because 18 inches below the ceiling level is fire hazard. So no, we've had no issues with it, besides trying to put stuff on top of it to get the reading maximized.
What has been the clinical staff's reaction to the system? Are there any issues with the usage of the system?
No. The clinical staff would prefer that we had everything on the Wavemark system, so they wouldn't have to still use our scanners that we use for everything under $50. It's a little bit more accurate. It gives all the details, and it's easy to use. They really don't have to think about it a lot because inventory is pulled out of their hands, and all they have to do is wave that box in front of the thing and keep on doing their thing. The inventory part is now left up to us, when before techs were more responsible and having to help us manage the inventory.
Were there any surprises in the data when you first started using the Wavemark system?
I wasn't here during the original launch, but from what I hear, we had a lot of expired items, a lot of things that we had excess inventory, products that were never used, manufacturers that never identified it. When I came in here, the first thing I tried to do was on a monthly basis reduce unused inventory or items that had never been touched. That way we were able to minimize our inventory and start maximizing on those things that we did need.
Okay. Have you seen more efficiency during procedures and turnaround?
The efficiencies that we have is just being able to have the tools available to them. The procedures are pretty, I mean, we run pretty hard here. The efficiencies is trying to identify how to make it available for them so that leaving the room is less time for them to have everything available. So I try to position everything in segregated areas so they don't have to do a lot of searching for what they need, but not really. Just a lot of inventory control and cost savings.
And who maintains the master list of items? In other words, how do you know when you barcode it what it is?
How do I know?
Yeah.
Well, the database, Wavemark has a virtual database that is encrypted to all of our information is encrypted to us that they maintain. And Quentin, you can talk a little bit more about this. I suggest where you maintain the data, but the barcode already has all the manufacturer information on it, and we just register the antenna, the tag to it. So, but Quentin, can you explain a little bit of where you repository your data? How you hold it for us?
I think the question has to do with the maintaining of the list from all the medical device manufacturers of what those barcodes translate into for those products. And Wavemark maintains that for all of our customers, so it doesn't have to be maintained individually within the hospital.
One more thing that I wanted to add is Wavemark also has a catalog of most of the new items that are rolling out. For an example, we just rolled out today a new balloon, a peripheral balloon, which we had to add about 50 SKUs to our database. And Wavemark automatically has a catalog where all of them are already in there and identified. And I can just put par levels and they automatically show up without us having to do a million different transactions. And then I can go ahead and remove the one it replaced. It's simple couple clicks. So when the product arrives, we register it and it already recognizes it. So the Wavemark does a lot of the initial work for us, so we don't have to set up the barcode and everything else ourselves.
Here's a question about a double documentation where, particularly with a hemodynamic system like Cath Lab, and I can answer this question. We actually have a barcode simulation interface to the Cath Lab system where essentially when somebody scans a product at the point of care station for Wavemark, that same information is transmitted over to the Cath Lab system. And one last question here. Do you think your supply expenses are as low as they could be? And if not, what could you do to reduce costs further?
Well, I hate to admit it, but no. My supply expenses aren't where they should be. They can be reduced quite a bit. The problem, like I said, is I have 140 cardiologists, and after you give them the piece of candy, how do you take it back? I've identified, every day I identify by looking at the information, things that we can reduce. My new goal is probably to take a segment at a time and identify those sizes that are mostly needed and try to reduce the amount offered of every one slowly without compromising clinical needs, but in every category. So we'll probably take peripheral balloons, then we'll take peripheral stents, try to minimize on probably manufacturers, a few manufacturers and a few sizes of each, and see if we can continue to function at the same rates based on the data. So that's the new goal, to reduce slowly. A lot of it's consigned, so we don't really have a financial impact, but we do have lack of space. Which is, I can continue to add cabinets, but it's not always efficient when you can actually reduce your inventory for things you don't need. One of the reports that Wavemark gives that's a little scary is an actual, based on your rate of turns, what is your amount of product that is in danger of being expired? And we have quite a bit that doesn't turn fast enough that will eventually expire. And that's a big dollar figure that we're not looking forward to for the manufacturer or for us to assume that expense.
Okay, a couple of other questions that have come in. Just to let everybody know, the webinar has been recorded and will be available on the Wavemark website within a couple of days. Some of you have requested the slides from the presentation. If you could please send me an email separately, and I can get those slides to you directly. And I think that's about it. I would like to thank Margie for sharing her story with us today, and thank you everyone for listening in, and have a nice day.
Thank you, Quentin. Thank you, everybody. Have a good day.